Your doctor has prescribed an AeroChamber Plus Flow-Vu anti-static valve holding chamber with mouthpiece, or AeroChamber Plus Flow-Vu anti-static valve holding chamber with large ComfortSeal Mask for treatment of your respiratory needs. AeroChamber Plus Flow-Vu anti-static valve holding chamber carries on the over 25-year AeroChamber legacy of quality and brand performance. It has also been enhanced with several other significant features to ensure maximum effectiveness and provide additional peace of mind for both patients and caregivers.
Let's start by talking about why you need your metered dose inhaler, or MDI. MDIs are medication delivery devices used by people for a variety of breathing disorders. If you have difficulty breathing, it's usually because not enough air is getting into and out of your lungs. People with healthy lungs are able to breathe in and out normally, obtaining the amount of air needed by the body. With some people, air can't always move in and out of the lungs easily. This condition could be the result of the narrowing of the tubes that lead to the lungs. This could be caused by swelling inside the tubes, contraction of the muscles that encircle the tubes, or accumulation of mucus within the tubes. The medicine in your MDI helps you overcome your breathing problems. While some medications are used to provide fast relief of breathing difficulties, other medications are used for long-term preventative reasons. Your physician will instruct you on how often you should use your MDI and your AeroChamber Plus Flow-Vu aVHS. It's important to follow only the orders or advice of your physician or other healthcare provider. They, along with this video, will show you the proper way to use your MDI and AeroChamber Plus Flow-Vu aVHS. Your MDI is made up of two components, the canister and its plastic boot. The medication is in the canister, which is placed in the plastic boot. When the canister is depressed, the MDI releases a spray puff containing measured amounts of medication. Your physician will prescribe the number of puffs that are right for you. The AeroChamber Plus Flow-Vu aVHS is an aerosol delivery device designed to work with your MDI to make the medication delivery even more effective. The AeroChamber Plus Flow-Vu aVHS will make it easier for you to use your MDI and will maximize the delivery of medication to your lungs. This is done by separating the smaller particles of medication from the larger particles. The smaller particles flow easily to the affected area of the lungs. The larger particles, which can cause throat irritation, cough, and infection, remain in the chamber. The chamber holds the smaller particles of the medication until they are inhaled into your lungs. The one-way valve located near the front of the AeroChamber Plus Flow-Vu aVHS opens, allowing the medication to flow into your lungs as you breathe in, but will not let you exhale breath back into the chamber as you breathe out. This feature allows you to take more than one breath as the medication is held in the chamber, so you're confident you're getting the maximum amount of medication into your lungs. The clear chamber allows you to see the medication from the inhaler enter the chamber. The AeroChamber Plus Flow-Vu aVHS with Flow-Vu Inspiratory Flow Indicator is an indispensable tool that caregivers can use to visualize how to actuate the pressurized metered dose inhaler in conjunction with their patient's inspiratory maneuver. When the Flow-Vu Inspiratory Flow Indicator moves from the vertical position towards the patient is inhaling. As the patient stops inhaling or exhales, the Flow-Vu Inspiratory Flow Indicator returns to the vertical position. Another feature of the AeroChamber Plus Flow-Vu aVHS is its clear anti-static chamber. Unlike static-prone chambers in which static-charged aerosol particles are attracted to the walls of the chamber, the AeroChamber Plus Flow-Vu aVHC minimizes static charge and in turn increases aerosol suspension time for up to 10 or more seconds after the pressurized meter-dose inhaler, also known as an MDI, is actuated.
Other important features of the AeroChamber Plus Flow-Vu aVHC include Easy Flow Exhalation Valve. Integrated exhalation valve minimizes rebreathing and directs exhaled flow away from the patient's face. ComfortSeal Mask for the large mask only. The ComfortSeal Mask is made of a soft, pliable material for a snug fit and secure seal, limiting entrainment of ambient air and maximizing drug delivery. Flow Dynamic Valve and Baffle System prevents patients from exhaling into the chamber so that the remaining medication is available for the next breath. Universal Backpiece fits commonly prescribed MDIs for easy insertion and removal. Small, portable chamber. The AeroChamber Plus Flow-Vu aVHC is the ideal size for clinical effectiveness and people on the go. FLOWSIGnal Whistle provides feedback when the patient is inhaling too rapidly, encouraging proper inhalation technique. Easier to clean. AeroChamber Plus Flow-Vu aVHC take-apart design is dishwasher safe. It's important to remember the AeroChamber Plus Flow-Vu aVHC must be used consistently, correctly, and in a manner that is beneficial to your breathing. The AeroChamber Plus Flow-Vu aVHC with Mouthpiece was designed specifically for older, more coordinated children and adults, and the AeroChamber Plus Flow-Vu aVHC with large ComfortSeal Mask for patients who cannot form a sufficient mouthpiece seal or may still have trouble coordinating. The following instructions will help you ensure all of the medicine gets to the right place, your lungs.
Let's review the basic technique recommended for using your AeroChamber Plus Flow-Vu aVHC. Find a comfortable sitting or standing position. Then take the caps off the mouthpiece of the MDI and the chamber. Using either the AeroChamber Plus Flow-Vu aVHC with Mouthpiece or large mask, shake the MDI well to evenly distribute the medication throughout the canister. Insert the MDI into the backpiece at the end of the chamber. Now the backpiece is designed to accept most metered dose inhalers. Hold the MDI steady by gripping it with your thumb on the bottom and the first two fingers of your hand on the top. Now, place the mouthpiece of the chamber in your mouth and put your lips around it. Breathe out fully. This empties your lungs of air and makes sure you'll be able to breathe in deeply. If you are using the AeroChamber Plus Flow-Vu aVHC with large ComfortSeal Mask, place the mask around the mouth and nose, forming a good seal. The Flow-Vu inspiratory flow indicator only moves if the patient has a good seal. Now press down on top of your inhaler to spray one puff into the AeroChamber Plus Flow-Vu aVHC. Immediately begin to breathe in slowly and deeply. It's important to breathe in slowly. A slow breath will carry the medication deeply into your lungs where it's needed and most effective. Now hold this breath for as long as you comfortably can, say 5 seconds. Then breathe out slowly. A 10-second breath hold is best. If you cannot take a full deep breath, leave your mask or mouthpiece in place as you breathe out. Continue breathing normally for 3 breaths to make sure all the medication has been taken into the lungs. Be sure to administer only 1 puff at a time. The AeroChamber Plus Flow-Vu aVHC with Mouthpiece and AeroChamber Plus Flow-Vu aVHC with large ComfortSeal Mask are equipped with a FLOWSIGnal Whistle, which emits a warning noise to let you know if you're breathing in too quickly. Remember to replace the caps of your AeroChamber Plus Flow-Vu aVHC and MDI. Okay, you're all set. Thanks, Kate. If your physician has prescribed more than 1 puff, shake the canister and AeroChamber Plus Flow-Vu aVHC to mix the medication and repeat this inhalation technique. You should repeat all of these instructions for as many times as prescribed by your physician or healthcare provider. You should also review your technique with your physician on your next visit for further confirmation of correct use.
The AeroChamber Plus Flow-Vu anti-static valved holding chamber can be used right out of the package and then cleaned weekly. An instructional insert is also included in the chamber package. The AeroChamber Plus Flow-Vu aVHC is made of durable anti-static plastic material and has only one moving part, the one-way valve. With repeated use, residue may accumulate inside the chamber and around the valve. This may eventually interfere with the effectiveness of the chamber. Let's take a moment to review the cleaning instructions for the AeroChamber Plus Flow-Vu aVHC. Remove the back piece. To detach the front piece, simply twist the chamber as shown. Soak the parts for 15 minutes in a mild solution of liquid dish detergent and lukewarm clean water. Shake gently, then rinse the parts in clean water. Shake out the excess water from the parts and allow to air dry in a vertical position. Ensure parts are completely dry before reassembly. The AeroChamber Plus Flow-Vu aVHC is also dishwasher safe. Place the parts in the top rack of the dishwasher and ensure product is securely placed face up as shown. Be sure to use dishwasher soap and a rinse aid. Remove from the dishwasher when completed. Shake out the excess water from the parts and allow to air dry in a vertical position. Ensure parts are completely dry before reassembling. To reassemble, fit the front piece on the end of the chamber and twist firmly until securely locked into position. Center the alignment feature on the back piece with the Flow-Vu inspiratory flow indicator as shown. Press firmly to attach the back piece. Examine your AeroChamber Plus Flow-Vu aVHC visually before and after cleaning to make sure all parts are properly secured. Your chamber should be visually inspected before and after daily use. You may need to replace the AeroChamber Plus Flow-Vu aVHC after 12 months of use.
As you've seen here, both the MDI and the AeroChamber Plus Flow-Vu aVHC are specifically designed to help you get the medication you need to your lungs. The meter dose inhaler, along with the AeroChamber Plus Flow-Vu aVHC, should become a part of your everyday routine. The AeroChamber Plus Flow-Vu aVHC is a unique device designed to aid you in effectively delivering your medication.
This video included instructions to assist in using the AeroChamber Plus Flow-Vu aVHC with Mouthpiece and AeroChamber Plus Flow-Vu aVHC with large ComfortSeal Mask. Rest assured that the AeroChamber Plus Flow-Vu aVHC will provide the relief you need and give you more time to breathe easy. Please remember to read the complete instructions included with the AeroChamber Plus Flow-Vu aVHC in addition to watching this video. Monaghan Medical Corporation has a full line of respiratory products that include valved holding chambers such as the AeroChamber Plus Flow-Vu aVHC with small or medium ComfortSeal Mask designed specifically for children. It's important for you to follow the instructions given to you by your physician or licensed healthcare professional, as discussed in this video. Thank you for using the AeroChamber Plus Flow-Vu Anti-Static Valved Holding Chamber.